Here is a step-by-step guide that can give you a general idea on how to administer the insulin injection. There are several types of insulin pens, however, the principles are similar. We will use one type of insulin pen in this video. Please ensure you use the right pen for yourself. How to store your pen. Before first use. Keep your pen in the outer carton to protect it from light. Keep your pen in a fridge between 2 degrees and 8 degrees Celsius. Remember to remove your pen from the fridge at least 1 hour before use. Do not freeze. After first use. Keep your pen at room temperature below 30 degrees Celsius. Store your pen with the cap on, away from direct heat or light. Always dispose of used needles in an appropriate sharps bin. Never put your pen back in the fridge. Never store your pen with the needle attached. Step 1. Gather the supplies. The insulin pen for the insulin you have been prescribed. The correct needle for your insulin pen. The sharps container for safe disposal of used needles. Step 2. Prepare the insulin pen. Take the cap off the insulin pen. Attach a new needle and remove the outer plastic cap from the needle. And also remove the plastic needle cover. Step 3. Air shot. Turn the dose selector by 2 to 3 units and press the injection button down all the way to ensure insulin comes out of the needle. If no insulin comes out of the needle, repeat the safety test up to 6 times. Remember, the pen should return to 0. Failing this, replace the needle and test it again. If insulin still does not come out, use a new pen. Step 4. Dial to the prescribed insulin dose on the pen. Turn the dose selector until the pointer lines up with your intended dose. If you cannot select your full prescribed dose, split the dose into 2 injections, or use a new pen to make up the remaining amount. Step 5. Prepare the injection site. Choose an injection site such as your tummy or thighs, or the fatty area on your upper arms. You should inject under the skin, and to prevent damage, you should inject into a different site each time. Select an injection area and rotate your injection sites within that area for approximately a week. Do not change injection areas daily, only sites. Here is an example on how to use each area of the tummy for a week. Skin changes at the injection site. The injection site should be rotated to prevent skin changes such as lumps under the skin. The insulin may not work very well if you inject into a lumpy site. Contact your diabetes healthcare professional if you are injecting into a lumpy area before you start injecting in a different area. Your doctor may tell you to check your blood sugar more closely and adjust your insulin or other anti-diabetic medication doses. Step 6. Administer the injection. Hold the insulin pen in a way that is comfortable for you and allows for proper control. Insert the needle at a 90-degree angle or as instructed by a healthcare provider. Inject the insulin slowly and steadily push the injection button all the way down. When you see the 0 in the dose window, slowly count to 5 to 10 seconds to make sure you inject the full dose. You can then release the injection button and remove the needle from your skin. Step 7. Disposal. Dispose of the used needle in a sharps container. Place the pen cap back onto the pen and store it at a room temperature. Never take insulin out of the pen with a syringe. Remember, it is crucial to consult a healthcare provider if you have any queries or concerns. There are several types of insulin pens. However, the principles are similar. We have used one type of insulin pen in this video. Please ensure that you have used the right pen for yourself. For more information on how to administer the insulin pen, you can visit the resources provided here. Thank you for watching.